everyone. Back to Your Comments Matters. I'm your host, Carol Love, and we have another great video for you today dealing with the Medicaid and Medicare issues that's facing Americans here today. Well, this story today is coming all the way from 12 News, and it's titled Big Beautiful Bill for Arizona. So we've seen Arizona, we've seen Tennessee, we've seen New Jersey, many other states showing us what they have to go through with their Medicaid cuts. And if you guys are noticing, there's a pattern, isn't it? There are people involved that's going to be affected on the negative end of this big, beautiful bill cuts into the healthcare system. Well, we got some great commenters here today. We got comments coming from Christina Morales, Dirty Bloomers, Dr. Plandu, and Anthony Thompson. So if you're watching the show today, we want to say your comments matters. And welcome to the show here on today. Well, without further ado, let's get into the video and let's see what this state, Arizona, is going to be facing with their upcoming Medicaid cuts. Let's take a look.
The House has passed President Trump's sweeping mega bill, a multi-trillion-dollar package filled with tax cuts, spending changes, and some of the biggest federal safety net reductions that we've seen in decades.
And supporters say it's a bold move for America's future. Critics argue it's devastating for working families and rural health care specifically. So joining us now live in studio is Will Humble, Executive Director of the Arizona Public Health Association. Thank you for being here this afternoon.
Yep,
we have a lot to get to, but we want to start first with Medicaid cuts. So how is this going to affect Medicaid services and specifically the older Arizonans using those services?
So you've heard a lot about what the cuts on Medicaid. There's a few areas that's going to happen. The first impact is going to be what's called work requirements for Medicaid members that are able-bodied adults. So that's people between 13 years old and 64. So they would be expected to go to the state Medicaid agency and report online, I don't know how they're going to do the reporting, and say, prove I'm in school or I'm working, and these are the hours that I'm working. And the people between 13 years old and 64 are, when this gets implemented in late 2026, they'll have to do that in order to keep their Medicaid insurance. Now, a lot of people think, well, they should just get off the sofa, and people who won't get off the sofa, good that they don't have their health
probably
insurance.
a pretty generic
the bums, right?
I've heard them say it over and over. But really, the way people get kicked off Medicaid in a system like this, and Arkansas already did this a few years ago, is people are unable or don't know how to report their school or work, and then they get kicked off Medicaid, not because they don't meet the work
You're talking about you don't know how to report it. Come on now.
To report the actual school or work.
Fill out the form and mail it back in.
Okay, let's talk about beyond the health cuts. Some people think that this is really a statewide economic risk. We're talking hitting hospitals, rural clinics, small businesses, and state tax revenue. Will the impact really be that severe, though?
If you take what's here on paper, I think, yes, it will be severe. Just as severe as that? Not today. So one of the things they did with this bill is they give everyone the tax relief today. Right?
Which is the upside. So let's talk about that, if that's the silver lining.
And the pain, if you're wealthy, it is.
Sure.
The pain is kicked down the road. So the work requirements at the end of 2026, the reduction in the provider tax that Arizona uses to draw down the federal funds, that's cutting in 2028. So when those things happen in 2028, if they do, then that's when all that rural pain would happen. And it's because directly of
if they do, they will
care, especially in rural Arizona. Well, why rural Arizona? Because there's twice, percentage-wise, there's twice as many people on Medicaid in rural Arizona than urban. In urban Arizona, it's only 17% of people on access or Medicaid. Rural Arizona, it's 38%. So those hospitals have a lot more exposure to people that will become uninsured as these measures kick in between now and 2029.
Yeah. And you touched on it just briefly here with the EVs while we were talking. So the plan also ends tax incentives for the green energy, the power plants, homeowners, and car buyers. So what impact is that having, the two biggest impacts on sustainability?
That's immediate.
Okay.
So at the end of September, if you wanted to put rooftop solar on, you used to enjoy a 30% tax credit for that. That's ending September.
Okay.
This year, September.
Sure.
The EV tax credit ends in December. That's a $7,000. And if you're a business who wanted to invest in EVs, that ends at the end of this year too. So the EV, they were adamant about getting rid of the clean energy parts of this. And
Wow.
So they did it exactly this year. The Medicaid paying parts, they kicked down the road. Whether they ultimately happen or whether a future Congress undoes those or a future administration, a lot of these things are after he's gone.
Well, and that's what you had mentioned, like 2028. So the new administration, whoever that may be, can come in and maybe reverse course before some of this stuff takes effect?
Yes.
Okay. So.
And you know, one more thing, you argue that those incentives, they would drive up the cost of electricity for a lot of homeowners over time. But why wouldn't it
that's the
actually
last thing you need.
lower the cost? And really, because the utilities may be getting the cheapest kind of energy without needing to worry about renewable requirements.
Well, right now they're enjoying that tax credit for investing in solar, which builds their capacity for solar in the future, which doesn't require a fuel like natural gas, for example.
I swear, sometimes this stuff is like
that
blah, blah,
tax
blah,
credit
blah,
helped them
blah.
provide the capital investment to get us to a more sustainable and cheaper sources of energy that don't require fuel like natural gas does. So over time, they expect this will drive up electricity prices. Now, that's happening already. APS has already put in for
We've all seen it in our
15%
bills.
rate increase. They already asked for 8% 2 years ago. So the bills keep going up. And that's another thing about all of this stuff is that
No
higher
Medicare, you ain't gonna have no
electricity bills hit poor people the
utility.
hardest.
That's
Medicaid
right.
cuts hit poor people the hardest. Poor people are not benefiting from the tax cuts.
That's right.
So it's lower income people that are suffering point by point by point
By
by
point.
point.
It's always the
Bill,
poor
really
man.
appreciate your insight. And because this
Yes.
is so expansive, is going to impact so many people. 12 News journalist Joe Dana is working really hard on the specifics on how this is going to impact people here in Arizona. So he's going to have that story coming up on 12 News tonight at
All right, then, everyone, you start right there at the 12 News in Arizona, where they are discussing. The guy named Bill, Will, was discussing about the impact of this big, beautiful bill that was passed last year that's going to have an impact on people that lives in Arizona. Y'all remember what he said? He said the bill is filled with tax cuts. Critics say it's devastating. The poor are the ones that's going to be impacted the most. The first impact, as Will stated, was what? The work requirements. Anyone 13 to 64 must prove their hours to keep their Medicaid benefits. To get kicked off, those who do not know how to report, that doesn't make sense to me. If you own it, what you talking about? You don't know how to report that you're still, providing the work requirements that's needed. You fill out a form. Don't they send you a form? You can get online. You be online looking at everything else, social media. I know you know how to get online and go to the website and fill out whatever you need to fill out. Come on now. If you get kicked out because you're either illegal or you're just lazy and don't want to fill out the form. Okay, then he said, hospitals, small businesses will be impacted in the future. And the pain, they're just kicking it down the road. You heard that term where they say they kick the can down the road. They're kicking your pain down the road. Basically, they're kicking your death down the road. That's what they're doing. Inevitably, your death is at the end of the road if there is no help with these Medicaid cuts. He says, in 2028, cuts will hit the rural areas. And in that state there, Arizona, it says 38% of the population are in the rural areas. They're going to be affected. That's a lot. That's a big percentage. And then he said that they was getting these EV tax credits. That's ended. They was getting what, like $7,000 a year. That's ended. And then it says, he said, the new administration that's going to be coming in 2028 election can reverse these impacts that have been put upon the poor of the poor of the poor. So it can be reversed. Thank goodness for that. So we hope and pray that that will happen. All right. Okay, then, everyone. So we saw the video. We got some little highlights on it. Let's get to those commenters and see what they have to say right there in Arizona with the big, beautiful bill cuts. Take a look. Our first commenter is coming from Christina Morales. And Christina says, low-income families, the working poor, vets, those serving mental health in our communities, and seniors who are just living on a low income are the ones who are impacted. Absolutely. Now, that is the best comment so far on this subject that we're dealing with, the Medicaid cuts. Christina, you got 15 likes on that comment. That's why your comment matters is right here on our show today. Let's take a look at Dirty Bloomers. Dirty Bloomer says, another nail in the coffin for rural life in America. The high school grads are going to have even greater incentives to leave the rural areas for the cities and larger towns, meaning more land for the ultra rich and corporations to swallow up. Now, Dirty Bloomer, you know you got that right. That's a good comment. You got 32 thumbs up on that. You're so right, because the more they keep attacking the rural America, you know, rural America is the one that keep food on the table. Okay, you need your rural America, and so rural America need the little small businesses to support them. And so, if you get rid of their health care, what are they going to do? Like Dirty Bloomer said, what is the incentive for the young people, the high school grads, to stay in these small towns? There is none. And when the young leave and it's only the old that's left, and the old now what that's left is poor and needy, and the government is taking from them, that town is dead. Now that town is dead. And just like Dirty Bloomer said, now the town is ripe for the big greedy corporations to come in and build up their more housing, more expensive housing, more data centers. Y'all, we got to stay on top of this. We got to stay in tune to what's happening to us senior citizens. They're trying to get rid of us. That's what they're trying to do. Trying to get rid of us senior citizens. Wow, this is something else. Let's take a look at another one. Dr. Plando, number 14 says, and the Fed recently cut funding to Arizona education. And he said that rural Arizona residents on Medicaid are going to hurt. Sounds like they voted against their own interests. Hey, Arizona is a red state. Y'all know how it was when the election was going on and who's voting for who, and you seeing the maps, red map, blue map, and then you get just what you voted for. But you thought it was going to be for the illegals, criminals. Then we gonna get the criminal. But they seeing you as a criminal because now they want to cut you too. Talk about karma, huh? Wow, this is too much. Hey, listen, we got time for one more comment coming from Anthony Thompson, 3806. Anthony says, a couple of things that gall me about AHCCCS in Arizona. Number one, people making way more money than me and having more money saved than me and still receiving it while I got told no when making $14 an hour in 2022. Number two, career detox bunnies who hop in and out of detox 30 times in 1 year when I got $9,000 bill for one stop. But they still have money for booze, dope, and motels in between. Gotta love that visionary middle class and bureaucratic AHCCCS social justice. He even put a smiley face at the end. But you know, when you think about it, ain't nothing smiley about this. This is serious, isn't it? And he's right. He's saying what's affected him. He said, hey, look, I'm here and I'm making $14 an hour and I get a $9,000 bill. But you got people making more money than him and they get the system, they get to scam the system. Something ain't right. Something is wrong with the picture. So this is why your comments matters, everyone, because you're not alone. When you make these comments out there, you're not alone. Anthony, you got 5 likes on that comment when I saw it. Okay, you probably got many more by now, but I'm hoping that anyone that's watching this video, or do you agree with our commenters today? Christina Morales, Dirty Bloomers, Dr. Plando, and Anthony Thompson. If so, let us know in the comments below if you agree or not with their comments, and what are your thoughts? Even if you don't agree with their comments, what are you thinking about the cuts in Medicaid and Medicare? All right, then, everyone, that's going to do it for us. Thank you again for our commenters. As we always say, we're going to see you on the next video. Thanks for watching, liking, sharing, commenting, and subscribing to Your Comments Matters. I'm your host, Carol Love, and I'll see you on the next video.